All right, so the easy way to do the lateral forearm is to needle where the pain is and to needle where the trigger points are, right? The complicated way is to get out your like anatomy book and be like, all right, like there's the lateral epicondyle, right? There's the lateral epicondyle. And then we have like ECRB, ECRL, right? ECR, extensor carpi radialis brevis, is the long tendon. ECRL is the more meaty, and it's going to be above that. So if we can find lateral epicondyle there, lateral epicondyle there, okay? Extensor carpi radialis longus, push back into my hand. We're looking for a muscle belly and relax. Looking for a muscle belly, come up and relax. Again. Don't want brachioradialis. One more time. Okay. Should be a little bit above. Should be a little bit above condyle. Okay. And then we're gonna have quite a few layers of muscle here. Let's see if we can find that long tendon. Where's that long tendon? Made this hard on myself. Right here. Dink. Tink. And that should be like right here. All right. Roughly. Okay. And then we've got ECRB, extensor carpi radialis, extensor digitorum. Wiggle, wiggle, wiggle the fingers. Wiggle, wiggle. You guys see that? So that little, the wiggle, wiggle. That's supposed to be extensor digitorum. Extensor digiti minimi. Wiggle your finger. Right, so you can play these games, and it's fun to play, but hold it there. Hold your arm there. Yep. What muscle is that? Brachioradialis. So brachioradialis is usually like, kind of like that. And then brachialis, and biceps, right?
Do you need a bicep a lot?
No, I don't, not a lot. TJ had a patient that had a bicep surgery. Second time, she called him freaking out, thinking she had torn it again. Felt like she had torn it again. The first surgery failed, by the way. They redid whatever they did on her biceps and it didn't help her. She called him, freaked out, and it was actually like musculocutaneous nerve entrapment. Did you work on neck or ribs? Or?
She had an intercostal nerve entrapment.
Yeah, so. I've never needled biceps, maybe once or twice in like 15 years or something. Oh yeah, that's one of my spasticity patients where you needle like everything a little bit. Yeah. So you can play these games, you can tease out these muscles and stuff like that. If someone comes to you with tennis elbow or lateral epicondylopathy, first thing we want to do is check the radial nerve. Does that reproduce your pain? Yes, it does. Okay, move your head. Does that take your pain away? Yes, it does. Okay. We have radial nerve involvement. The next question is, do we have an actual lateral epicondylopathy? Hold your finger there. Push, push, push. If that reproduces pain, we have both. If it's radial nerve only, it's radial nerve only. If it's lateral epicondylopathy only, it's lateral epicondylopathy only, okay? If it's chronic, it's probably both, or just nerve. You never know. You have to check.
Did you side bend the head towards the affected side?
Whichever. As long as if the head changes the symptoms, right? Usually you would not try to increase the tension. Usually you would try to take tension off, okay? But that's another course for another time. Probably we have a 1-hour course on that online. Everything is there. So.
You remember we did the lecture in that of college?
Yeah.
Even the.
Yeah. Yeah. So wherever the pain is, right, you can needle that. You can also just needle the extensor bulk as a whole. We do have radial nerve in here. So if I was going to needle this guy, I would try really hard to be like, man, I'm going to start over here and I'm just going to canvas this area. And if you feel something nervy, is that it or no? If you feel something nervy, let me know. So there's radial nerve. We found something nervy. I'm going to see what I do with my fingers. I'm just going to kind of push it that way. And now I can bracket and I can needle all that extensor bulk. Boom, 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 boom. Welcome to the party. right? And usually these last two guys don't matter that much, extensor digitorum and extensor digiti minimi, like who cares, right? But maybe brachioradialis and ECRB, ECRL, that's usually where we're going after, right? So we just needled that bulk. So find radial nerve and then just come medial to that, or if you want to, you can kind of push it off to the side. And then let's just try to needle extensor bulk, okay? If there is a specific trigger point, you can bracket down onto the radius. You can bracket down onto the radius like that, or bracket down onto the radius like that, all right? I want you guys, I thought about skipping it, but I want you guys to do this one because you want to find radial nerve and miss it, whether you push it to the side or just know where it is, draw a line, and then come to the side,
We'll
right?
talk about BIN.
What about what?
BIN, posterior process.
Sure.
Okay, so so radial comes from here, and if you come like a little bit ventral, okay, and inferior, you'll find like a spot where radial becomes, is that tender? Very nervy. It becomes posterior interosseous nerve, okay, and this is, if you tap here, patient would feel like if it's entrapped, patient would feel like a dull, achy pain down the arm. Because it's a motor nerve, you're not gonna get numbness tingling. Yeah. So
Needle the proximal 2 inches, okay? Certainly you can poke around and stuff like that, but I would say just needle proximally in and around the lateral epicondyle. You guys should be fine, okay? I'm gonna demonstrate this one. We're not gonna needle it though. If a patient does have Dequervains, hold your thumb there. Do you guys see this anatomical snuff box is what this is called between this tendon and these 2 tendons? There's 2 tendons right here. Abductor pollicis longus, extensor pollicis brevis, never mind. There's 2 tendons right here. So this is the anatomical snuff box. There's 2 tendons here. Those tendons are the ones that if they're painful and swollen in this area, that's called Dequervains tenosynovitis. Confirmation test is Finkelstein's test. Grab that, pull down. Is there any pain or pulling discomfort in there? Okay. So in that case, you can drop a needle in, right? Do needle around the tendon. If you happen to be able to pierce the tendon, it's fine. It's not going to hurt anything, right? This is something you could do for pain, but more needs to be known about this for what's the best treatment methods and stuff like that, so you can check that out. We don't needle a lot of medial arm. I think I'm going to show it, but you guys probably not going to do it today. Find ulnar nerve, right? Ulnar nerve is way back here, way back here. So as long as we stay anterior to that, I can needle this bulk. We could needle it that way towards my fingers, right? If they have a golfer's elbow, just make sure it's not an actual like ulnar nerve. I'm gonna come up from ulnar nerve and we can needle this way, okay? There's a muscle called Pronator. Sometimes we get some like entrapment inside Pronator Teres. Thumb up, push into my finger. There's Pronator right there, okay? So this band right here that runs from medial epicondyle onto the radius over here, okay? Could needle that guy. I don't ever, okay? I don't ever. It's not really necessary, but you guys can. It's all in the manual, okay? Let's go needle. Let's get at least 1 stick in the extensor bulk, missing the radial nerve. I want 100% missing the radial nerve. It's not gonna kill anybody, but you guys can be that accurate, okay?